This is the gluteus maximus. You could see the letter on it. This is the lateral portion of the body. So this is the biceps femoris, medial portion of the body. We have this white tendon that belongs to that muscle called the semitendinosus. And then this muscle that it seems to be sleeping on, this is the mattress underneath it, letter R, that is the semimembranosus. So there's actually two muscles here. One, two. Semitendinosus and semimembranosus. Gastrocnemius, you could see the letter associated with the gastrocnemius. This is the soleus. You could see the letter associated with the soleus. Now we are looking at the anterior portion of the lower extremity, and right near the tibia bone is a muscle known as the anterior tibialis, or tibialis anterior, which inserts on the first metatarsal and the medial cuneiform bone. This muscle right down the middle, originating on the anterior inferior iliac spine and inserting via the patella, patellar tendon, this ligament here, onto the tibial tuberosity. This muscle is the rectus femoris. On either side of it, the medial side and the lateral side, this is the vastus lateralis and the vastus medialis. This white band here is called the iliotibial tract, or the iliotibial band. And this muscle up here pulls on that. This is called the tensor fascia latae, the tensor of the lateral fascia. The tensor fascia latae pulls on the iliotibial band or iliotibial tract. This is the anterior superior iliac spine, which is what this iliac crest seems to end in. And then it's the anterior inferior iliac spine. This happens to be the origin of the sartorius. This happens to be the origin of the rectus femoris, this muscle. The sartorius and rectus femoris originate on the anterior superior iliac spine and the anterior inferior iliac spine. 1, 2. 1, 2. This one originates lower down. This muscle that swings from the lateral aspect all the way to the medial aspect near the tibia originates on the anterior superior iliac spine and inserts here medially on the tibia is the sartorius. Sartorius, sartorius. This is the gracilis, the graceful gracilis near the abductor, near the adductor muscles. This is the gracilis, and the adductor magnus and adductor longus and adductor brevis are deep to that gracilis. So this is the sartorius. Way up here is the iliacus and the psoas major, forming the punter's muscle known as the iliopsoas. This here is the mastoid process of the temporal bone. The mastoid process of the temporal bone is what the sternocleidomastoid inserts on, the sternocleidomastoid. This is the supraspinous fossa. This is the infraspinous fossa. On the other side of this, right in here, this would be the subspinous subscapularis muscle origin area. This is the subscapular fossa. The levator scapulae inserts here, pulling your scapula upwards and just slightly medially. This is the insertion of the levator scapulae muscle. This is the deltoid, and this is called the deltoid tuberosity. This is the coracoid process. The coracoid process is also known as the origin of a muscle known as the coracobrachialis. This is the ulna. Looks like the letter U in there. See the letter U? This part way up there is letter Z. That is called the olecranon process. Olecranon process. This bottom part is called the coronoid process, and this is the part that starts with a TRO, trochlear notch that goes on the trochlea. The olecranon process can only go so far, and then it runs out of room. So letter Z is the olecranon process, which happens to be number 31, the insertion of the triceps brachii. Back here, this letter G, the ischial tuberosity, that happens to be the origin of the semitendinosus and semimembranosus and one origin of the biceps femoris muscle. That's letter G. Here we have an upper extremity. This is the deltoid muscle. This is the biceps brachii, and it's resting on the brachialis muscle. This is the brachioradialis muscle, the Popeye muscle. Brachioradialis goes from the humerus to the distal radius. This is brachialis, and way back here is the triceps brachii, the triceps brachii. This is the rectus abdominis. This is the internal oblique. This would be the external oblique. The fibers go this way. When the fibers go perpendicular to that, this is the internal oblique. You'll notice the internal oblique, here there's 2 layers, and here there's 3 layers. So when you take away the outer layer, you're left with 2 layers. The inner layer is the transversus abdominis muscle. The external abdominal oblique is listed here as well in this model. Notice how the fibers run. And this is the pectoralis major here. This is the deltoid and the biceps brachii. This muscle you see on top there, that is the muscle known as the palmaris longus. We have another practice test that we're going to do. It's a completely different practice test that will start in a second. This is the pectoralis minor. This is the pectoralis major. And this bump right here is the deltoid tuberosity. And you notice this is the ilium. This is the coxal bone. This is the pubis. This is the symphysis pubis right there, which is fibrocartilage. We also have fibrocartilage in our knee and the medial meniscus, and also these intervertebral discs. All right, let's start. Number 1, if you want to test yourself, turn the audio off. Number 1 is the dermis. It's the reticular layer of the dermis. Number 2 is the erector pili muscle or piloerector muscle. Number 3A is the stratum corneum. The stratum corneum, or horn layer, also called horny layer, the outer part, the dead part of the layers of the epidermis. If it's thick skin, the stratum lucidum, I suppose, is dead too. The stratum spinosum cells are alive. The stratum basale cells are alive. Those are the nice little capillary loops of the papilla going up the papilla, which are the little nipple-like projections. By the way, 3B, that is a sebaceous gland. It makes oil. It's also called oil gland. By the way, these are the sweat glands, sometimes called eccrine sweat glands. There's also apocrine sweat glands that make the stinkier sweat, and that looks kind of like what this one is here. This is the hypodermis, fat, basically. These are corpuscles for touch. They're called pacinian, or lamellated corpuscles. This one, there's plenty of videos on this model. This one is kind of short here. Basically, number 4 is a lamella, a concentric lamella, by the way, of an osteon. And this is a periosteum. There's plenty of other videos on this if you want to learn this a little bit more. And of course, the osteocytes are those cells that are in there that look like little bugs. And the Haversian canal, the central canal. This is the Haversian canal here. This is called Volkmann's canal, perforating canal. So let's go over that one more time. Volkmann's is the horizontal one here, Volkmann's perforating canal. This is the Haversian canal, the one that's more vertical. So I'll say that one more time. This one is the Volkmann's canal or perforating canal, and this one is the Haversian canal that goes up the osteons that are cylindrical. These are external lamellae, external circumferential lamellae. And then these ones that look like they're right in the middle, those are called interstitial lamellae. But I can't stop myself. This is the endosteum, endosteum. And we'll move on. All right, let's take a look now. That was number, what was that? 4 and 5. Okay, so we're going to go to 6, 7, and 8. 6 is the mandible, 7 is the zygomatic bone, and 8 is the temporal bone, mastoid process of the temporal bone. We need number 9. Number 9 is this one right here, and it is the no, it's not. It's the biceps femoris. The you have to look down here. You got lateral and medial. This one's near the fibula, so this one is the evil one, the biceps femoris, kind of angry to be in the back and be called a biceps. It's the biceps of right under the butt, and this is the semi-tendinosus, semi-membranosus. So number 9 is biceps femoris of the left side, and number 10 is the lateral belly of the gastrocnemius muscle, which causes us to stand up on our tiptoes, and it also actually crosses the knee joint. It originates on the medial and lateral condyles of the femur, so it actually works at the knee to flex it a little bit too. It also plantar flexes, so you stand on your tiptoes, so to speak, the foot at the ankle. Number 11 is going to do the opposite. That's going to dorsiflex, so your big toe will go up. The anterior tibialis inserts on the medial cuneiform bone and the first metatarsal. And number 12. 12 is the sartorius. 12 is the sartorius here. There's the big toe, so this is the left lower extremity sartorius right here. This is the vastus medialis, and this must be the rectus femoris. Number 15 here is the latissimus dorsi, and number 16 is the trapezius, the lower part of the trapezius. This is the upper part of the trapezius, middle fibers. 16 is the trapezius. 17 is the pectoralis major. 18 is the external oblique. And number 19 is the rectus abdominis muscle. Number 20 is the deltoid muscle. Number 20, let's look for 21. Where's 21? 21 is right here. That is the sternocleidomastoid, it looks like, the sternocleidomastoid. Yeah, that's what that 21 is. 22, male or female pelvis. This is a male pelvis. 23 is what we sit on, the ischial tuberosity. 23. 24 is right here. That's the anterior superior iliac spine. That's what the sartorius originates on, this bump up here. By the way, this is the female pelvis. And this is the male pelvis, and the tailbone has been broken off there. This is male pelvis, and this is female pelvis. You notice the opening here is larger to facilitate childbirth. 25 is the lumbar vertebrae, the body of the lumbar vertebrae. This is humerus, by the way, happens to be the right humerus. You can tell because these bumps go to the front and the head goes medially, so this would be the right humerus, and that's the head of the humerus. Number 26 is the head of the humerus. 27 is the femur. It happens to be, look at that spongy bone in there, very nice. This happens to be the right femur. This person's walking away from us. This is their right side. And this is the lesser trochanter, the lesser trochanter, the lesser trochanter. That's the greater trochanter, neck and head. And these are the condyles, medial and lateral condyles of the femur. The epicondyles have been partly broken off there. This is the manubrium of the sternum, manubrium. 28. 29 is the radial tuberosity. The biceps brachii attaches to the inserts on the radial tuberosity mainly. It's a bump right there that you can see. This is the rib. Number 30 is a rib, and it happens to be the back of the rib near the vertebral column. And the front part here is the anterior part, so that's a flat bone. That's the rib. This bone here, what is this? It has an olecranon process, it has a trochlear notch, and it has a coronoid process. What is the name of this bone? Gee, it's called the ulna, U-L-N-A. You can see the U right there. You see the L right there. N-A, ulna. Number 32 is the bifid spinous process of a cervical vertebrae. You can tell it's a cervical vertebrae because it has 3 holes. These are the holes that the vertebral artery and vein run through. The holes are called transverse foramina, and the hole right down the middle is in the back here is the vertebral foramen. The spinal cord goes through that. So number 32 is bifid, which means it actually has like a fork. It's kind of broken. Let me show you right there. The tape is still there. So that's bifid. It means it has 2, pieces sticking out. That's a cervical vertebrae. It's not C1 or C2. It's a little further down, but it's not the last 2. This one is the foot. And this is metatarsal 5, the letter V. Metatarsal 5. This one is Roman numeral 3, the third finger.